Thank you.
Dr. Bhasin, please.
Thank you, Dr. Garg. And at the outset, I would like to thank Professor Subudhi and all the chairpersons on the dais and in front of me. I'm Purendra BHASIN. Um, so, next slide, please. It's not. So, teleophthalmology, we know what it is, and but coming to the ophthalmic trauma, it's a leading cause of preventable vision loss affecting millions of people every year. In India, ophthalmic trauma is a significant health issue due to road traffic accident, agriculture injuries, and native sports, especially, and industrial injuries. Vast geographical and socio-economic disparities, lack of access to specialized eye care in rural regions, all these things are challenges in our country. And with the advancement in imaging technologies, high-speed internet and digital communication tools, teleophthalmology can bridge the gaps in healthcare delivery by connecting underserved areas with urban centers of excellence. So, what is the global challenge? Epidemiologically, WHO says that there are over 2.5 million cases of eye injuries annually occurring worldwide, and more than 5 lakh cases leading to permanent visual loss. So, this is the magnanimity of the problem associated with ophthalmic trauma. And in India also, it is the similar condition. The road traffic accidents are the most common cause of eye injuries, with over 1 million cases of trauma-related blindness or severe visual impairment recorded annually. Industrial and agriculture accidents also contribute significantly to the burden of ophthalmic trauma. So, needless to say about the types of ophthalmic trauma, we all know the impact of ophthalmic trauma is both physical as well as socio-economic, because there is a loss of vision to the patient, and at the same time there is a loss of productivity and increased healthcare costs. So, what are the challenges in treatment? There is a delay in treatment because of the poor access in the periphery of our country, inadequate infrastructure, and there is the limited availability of diagnostic tools in the periphery and the skilled professionals in the periphery. So, these are the three most important challenges. So, what is the role of ophthalmology? The remote consultation and diagnosis can be done, and we can do it in a center, and we can triage the patient, whether the patient require immediate care and immediate consultation, or they can be treated over there itself. Like we can see sometimes a subconjunctival hemorrhage patient comes from distance, and the child is having subconjunctival hemorrhage due to any reason, and they will come from distance to consult at the center. So emergency response integration and integration into the this emergency response integration should be managed, and on-site access should be given, and training and capacity building, that is the most important thing at the moment, which has to be adopted in our country. So, what are the benefits? There is an increased access to care. We can manage the cases timely, and treatment can be done. And with the delay, whatever problems occur and increase in the infection and damage to the optic nerve, etc. So they all can be avoided, and it is a cost-effective way of management, and there is an improved health outcome. Faster interventions in trauma cases lead to better recovery rates and reduced complications. The challenges are technological barriers, and because poor internet access and all those things are there, and which are still prevalent in our country. Quality of imaging, the poor quality imaging will decrease the consultation. There are regulatory issues which has been rightly highlighted by Dr. Mathur, and training and adoption, that I should say peripheral staff training is very, very important, which should be taken care by the Teleophthalmology Society of India along with AIOS. And availability of teleconsultation during odd hours in trauma emergency, which has to be adopted, which can be done through the Center of Excellences. Various case studies are there, as in India, as Professor Kim was telling, in Arvind Eye Care Center, they have started it for diabetic retinopathy, and they have been very successful in that. in Tanzania, which is a country like us, and emergency trauma networking has been done, and it is successful. In U.S. military, they have adopted it, and in the field, they use remote consultation with ophthalmologists, which has been proven to be a very effective way to provide emergency care on the front lines. So these are some models in India from Arvind Eye Hospital, Sankara Nethralaya, and AI-based diabetic retinopathy screening by LV Prasad Eye Institute, etc. So various gaps are there, as has been highlighted by Professor Madaria. India has only 20,000 ophthalmologists for a population of 1.4 billion population, meaning one ophthalmologist for 70,000 people only. So that is very less ratio. And 70% of the population lives in rural areas, but 80% of eye care specialists are in the urban centers. Mobile internet penetration in 54.5% only till 2023, which has to increase to 100%. And no clear legal framework or for the AI-based diagnosis or remote prescriptions for eye diseases, and which has to be taken care by AIOS. Low insurance coverage. Only 5 to 7% of telemedicine consultations are covered by insurance providers. So, what is the future? Future is AI driven, as has been rightly said by Dr. Kim. Portable, affordable diagnostic devices, integration of just 30-40 more seconds, integration of teleophthalmology with EMS system, expansion in developing countries to improve global trauma care. To conclude, teleophthalmology facilitates remote consultation, enables timely intervention, provides an efficient diagnostic platform, and we call for action is continued investment in teleophthalmologic infrastructure, AI technologies, and training programs that will be crucial for the future of trauma. Various cases are there. I had a case of post-keratoplastic consultation during the COVID-19, which has suddenly occurred. So with teleophthalmology, we could take the pictures of the patient and send it to our cornea specialist, so we could manage, and this way the graft survival was successful. And other things are also there. Various studies from China are there, which has given us the real-time picture and effect of teleophthalmology in their country. I thank you for your patient hearing.
Thank you, Dr. Bhasin, and thank you for